social justice has been an important dimension of the value base in adult social care. For example, anti-discriminatory practice or challenging inequalities. And we can see that some groups of people or some individuals are at a disadvantage already in society, for example, from health inequalities or because their disability or social situation means they're less likely to be able to get control over life or to be valued equally or even to be heard and to be believed. And of course, COVID-19 has exposed those inequalities and in some cases made them worse. So we always have an ethical framework with which we try and work to address social justice issues. And the kind of areas where we think you need to apply social justice, first and perhaps most obviously, the black and minority ethnic people's experience has been absolutely emphatically demonstrated during COVID-19 to be underpinned by inequality. And although it's complex, it's important to acknowledge that inequality and discrimination and to try and plan to make improvements in how we respond to that. Secondly, understanding specific groups and specific situations to try and improve people's rights and social justice. So if we think about people with dementia or people with living with mental health problems or autism or learning disability, then we can see that their experience of the last 3 months in terms of things like lockdown or access to treatment or actually ordinary rights of social care may have had a poorer experience because of those underlying conditions. And we need to work hard to try and compensate for that and to acknowledge that that's happening. It's played out in things like excess deaths. It's also played out in terms of people's ability to link with family or to undertake social activity. Thirdly, social justice for the care workforce itself. And it's really marvellous that during COVID-19 there's been acknowledgement that social carers are part of the key workforce and should be valued. But actually we've got to go a whole lot more and think about their position in society, mainly women, mainly low paid, and see why we can't improve that situation going forwards. And I guess the kind of tools that we would think are good ideas to use. Firstly, a kind of building on existing relationships and working in that kind of way. Secondly, acting in a rapid way. So thinking about having the mindset of rapid results, trying to take action now to address inequality and trying to have a bias towards decisions. Second tool, hearing from people, making sure that we give a voice to individuals, no matter how difficult that is and now how time consuming that is. If we don't do that, then we won't make the right decisions. Thirdly, collective understanding and trying to get agreement in society that some things are unjust and need to be challenged. Individual advocacy or peer advocacy, really important tool. As we think about how lockdown is eased, for example, we absolutely need to think about, are we being fair across the range of situations? It's unfair and wouldn't be acceptable for social care situations to remain locked down disproportionately longer than everybody else. And I guess lastly, one of the key tools is technology and the use of technology in the last 3 months to get access to people, to give access to services for people in a new way, to get information out and about, and to get connectivity between people and between families, really, really crucial. And then 2 other dimensions not to forget with social justice, the law and politics. I mean, at the end of the day, these are hard matters of rights. and should be considered in that way. And these are matters of choice. And in social care, whether to give resources to a situation, whether to give rights to somebody, and whether to try and address inequality is a matter of political choice. And whilst we're not a political organisation, we'll always try and get the facts out there so that political groups can take a view about those priorities and try to make the situation better.